Diversity in Healthcare, the Netherlands, by Jenna Schocker. The Netherlands is one of the countries under the Bismarck healthcare system. This means that individuals contribute to a common insurance fund. Essentially, this is based on solidarity. Everyone in the Netherlands must pay for insurance, but it is all based on how much money they have. By doing this, the universal healthcare is achieved. Furthermore, the Bismarck model works by funding healthcare through mandatory health insurance that everyone must have. This insurance is paid for by both employees and employers, not just taxes or the government. The goal is to make sure everyone can get healthcare, and it does this by mixing both private and public services. In the Netherlands, everyone has to have health insurance, whether they're Dutch citizens or foreign residents. The law requires everyone to buy a basic health insurance plan, which covers essential healthcare like doctor visits, hospital care, and medications. This insurance is provided by private or non-profit companies, but these companies are closely regulated by the government. The government also decides what must be used in the basic plan to make sure everyone gets a fair level of care. To keep things affordable, especially for people with low incomes, the government gives financial help or subsidies to pay part of the insurance premiums. These subsidies depend on how much someone earns, so the system helps ensure that low-income families can still afford to get health care. For more information, this is a video explaining.
You can use the chapters in the video description to quickly access the specific information you're looking for. Everyone who lives or works in the Netherlands is legally obliged to take out basic health insurance. This covers costs such as visits to your general practitioner, medication from the pharmacy, and hospital care. It's important that you register with a Dutch health insurance company within 4 months of arrival. The government determines exactly what is included in the basic healthcare plan, which is designed to cover the bulk of your essential medical care. In addition, insurers can offer supplementary insurance packages that cover, for example, physiotherapy or dental care. Insured care is equal for everyone. However, the way you receive it can vary greatly. You can choose either an in-kind or restitution policy, or a combination of both. With an in-kind policy, your health insurer reimburses the care costs only if the care provider has a contract with your health insurer. With a restitution policy, you'll be free to choose from any hospital or healthcare provider. In-kind policies are generally cheaper than restitution policies. With ONVZ, almost all care falls under restitution policies, so you can choose your own healthcare provider. What's more, ONVZ has contracts with many different healthcare providers, which means you can get the care you need quickly. We can even help you with waiting lists. Because we've contracted so many healthcare providers, we can more easily find one that's available. Everyone with the same policy pays the same amount. Age or health status don't play a role. Every insurance has a mandatory policy excess. The excess is an annual amount for medical costs that adults have to pay out of pocket before any costs are reimbursed under the basic healthcare insurance. If you don't expect healthcare costs and would like a discount on your premium, you can voluntarily increase the mandatory excess. But bear in mind that you will also have to pay more out of pocket if you do incur healthcare costs. For some care covered by the basic insurance, you don't have to pay an excess. For example, general practitioner care or maternity care. With your basic insurance sorted, the first thing you need to do is register with a general practitioner or GP, known in Holland as the huisarts, even if you don't need medical care right away. The role of the GP is central to the Dutch healthcare system. For many newcomers, this is the most important difference with back home. Your GP is the first person you visit when you have health complaints, including mental health issues. This is called primary care, and you can arrange a visit without a referral. The GP can refer you to a medical specialist if necessary. This is called secondary care, and you can only access it by means of a referral from your GP. All visits to the GP are covered. You don't pay in excess. However, if the GP refers you to a medical specialist or orders blood tests, or if you are prescribed medication, you will have to pay the excess for those services. If you go on vacation or need to travel abroad for work, you can also receive care from healthcare providers abroad. The basic insurance reimburses the cost of emergency care abroad up to the amount that this care would cost in the Netherlands. If the costs abroad are higher, you will have to pay the difference yourself. With ONVZ, you can also insure yourself for the part you otherwise would have had to pay with additional insurance called Wereldfit. If you want to know more about the Dutch healthcare system, simply download our guide or contact our service center.
When we take a look at the rankings, the Netherlands has one of the top 5 healthcare systems in the world. Because of this, you would expect that the country doesn't have a lot of problems, but that's very far from the case. For one, the need for insurers to make a profit in the country creates a major issue for the Netherlands, which is because it is a lot harder to obtain equitable healthcare for all citizens. Furthermore, 1 in 10 people in the country are most likely to not have fair healthcare, which increases demand for lower cost. The reason why people are not getting fair healthcare is because of insurers' profit goals. All these coverage providers are in a battle to try and make the most money, but this is putting the patients that need healthcare insurance at risk because prices might be too high for them to afford. A major problem for the country is their nursing staff shortage. One of the reasons for this shortage is that nurses have such a high workload, especially as healthcare risks increase, which makes it difficult for nurses to pay full attention to all patients. Another reason is the number of nurses to patients. Nurses are faced with dealing with way too many patients. This, combined with the fact that nurses have such a high workload, is extremely hard for them to stay in their fields without getting stressed out or burned out. This has greatly affected the Netherlands residents because doctor offices now have a longer waiting time. However, the worst part of it is that now healthcare assistants are being used as substitutes for nurses, which is extremely dangerous to patients since the assistants are working outside of their training scope. Another major problem is the inequality between rural and urban areas. Studies have shown that finding healthcare professionals in rural areas is one of the most important challenges in the Netherlands healthcare system. Additionally, this can impact the quality and accessibility of care. Specialized care is also very scarce in rural regions, and especially with fewer hospitals available. Those that do exist typically provide mostly general care rather than specialized services. As a result, patients requiring specialized treatment often need to travel to urban centers, leading to long journeys and possible delays in receiving care. Additionally, many rural areas lack advanced medical equipment, such as high-tech imaging, diagnostic tools, and surgical facilities, further limiting the availability of care. Looking further into resources, it has been found that healthcare professionals, particularly doctors and specialists, are more inclined to work in urban areas because of better career opportunities, stronger professional networks, and greater access to advanced training. Rural regions, on the other hand, may not provide the same level of career growth or specialized roles, making them less desirable to younger professionals looking to build their careers. Overall, it's crystal clear that the Netherlands healthcare system has many flaws and needs a lot of help and improvement. After looking at the Netherlands' healthcare flaws, this brings us to the question, how does the Netherlands compare to other countries who also use the Bismarck system? To fully comprehend the data, we need to get some basics down first. The countries that I'll be comparing the Netherlands to are Germany and Japan. Additionally, although there are many ways to measure the success of healthcare systems, the way I'll be comparing them is through life expectancy, infant mortality rate per 1,000 live births, and physicians per 10,000 population number. Lastly, before I get into comparisons, it's necessary to know what success would look like in these categories. For life expectancy, a higher number indicates more success because that means that people in the country are living longer lives. For the infant mortality rate per 1,000 live births, a lower number indicates more success because that means that babies that are born in that country have less of a chance of dying. Finally, for physicians per 10,000 population, a higher number indicates more success because that means that there are more doctors available in that country. Before getting into comparisons, let's discuss the Netherlands statistics in these categories. As we can see, the life expectancy is 81.1, the infant mortality rate is 2.21 per 1,000 live births, and the physicians per 10,000 population is 6.7. From looking at these numbers, it's difficult to tell whether this is good or bad, so let's look at other countries. Germany has a life expectancy of 80.71, an infant mortality rate of 2.34 per 1,000 live births, and 43 physicians per 10,000 population. When we compare the Netherlands and Germany, it's clear that the statistics of physicians are vastly different. The Netherlands does seem to be a bit better than Germany. It has a higher life expectancy and a lower infant mortality rate, although Germany is better in the physician category. From this information, we can see that the two countries' life expectancies and infant mortality rates are very similar, but the number of physicians aren't. This could show that number of physicians may not be as big of a factor in deciding how successful a healthcare system is. Now, the next country is Japan. Japan has a life expectancy of 84, an infant mortality rate of 1.604 per 1,000 live births, and 51.4 physicians per 10,000 population. These numbers show that Japan definitely seems to have a more successful healthcare system compared to the Netherlands. They have around 3 more years for their life expectancy, which is a significant difference. Furthermore, their infant mortality rate is also a bit higher than the Netherlands, with a difference of 0.604. However, while Japan's rates are better, they are not extremely different from those of Germany and the Netherlands, again supporting the idea that the physicians per 10,000 population may not be the biggest indicator on the success of a healthcare system. Additionally, a reason for this could be the quality of care. Less doctors with more knowledge and skills may outrank more doctors who have less knowledge and skills. Now, moving on from the healthcare system comparisons, cultural differences in a country are significant because healthcare professionals need to respect patients' culture and work with them if something doesn't work well with their traditions or values. When healthcare professionals are able to do this, patients feel more comfortable and they're able to take more of an active role with their health and well-being. Additionally, different cultures use different medicines, and some of them do have clear and scientific benefits, which is why healthcare professionals should be open to learning more about these medicines and treatments. All of this leads us to our main question. What cultural differences are present in the Netherlands, and what can healthcare workers do to respect these differences? First, let's talk about the Netherlands culture in general. Their culture has some special aspects to it. For example, they have a more direct and straightforward way of talking, which is different than a lot of countries. Healthcare workers can respect this by understanding that if a patient is talking to them in this manner, the patient isn't trying to be offensive. That's just the way many of the people of the Netherlands talk. Another example is that people of the Netherlands almost always show up early or exactly on time to appointments. This is to show their respect for the healthcare professional taking care of them. Because of this, healthcare workers should know what appointments they have for the day and when they are. Not only is this respectful for the patient, but this is a good practice for the healthcare worker as they'll be more productive and efficient. Additionally, gender equality is essential in the country. Healthcare professionals should make sure that they treat everyone equally and respectfully. The Netherlands is very inclusive to everyone, including transgender patients, people from the LGBTQ+ community, and more. By being mindful of this, the patient doesn't have to feel anxious or nervous about being themselves. Lastly, people in the Netherlands find that people staring at them are especially rude and aggressive. In order to respect this, healthcare professionals should try their best to not look at a patient for an uncomfortable period of time, and to not overstep any boundaries. However, this does not mean that the worker shouldn't look at the patient at all, because that would show the patient that the worker doesn't have good communication skills or isn't confident. Instead, the professional should maintain eye contact, just not for a prolonged period of time. Now, moving away from the Netherlands culture in general, it's also important to look at the different cultures that are present in the country because healthcare professionals need to respect and accommodate people with cultures that may have different beliefs when it comes to medicine. The major cultures that I'll be discussing are Turkish people and Muslims. First up is the Turkish culture in the Netherlands. One prominent cultural belief in this group of people is that traditional remedies will help sickness. Furthermore, Turkish people living in the Netherlands use lots of herbal teas, natural oils, etc., to cure illnesses. For healthcare professionals to respect this, it's 100% necessary for them to not try to convince them that their beliefs are wrong. Patients all believe in their own cultures for years and decades, and trying to convince them that what they're doing is wrong isn't going to get you anywhere. Instead, what should happen is that the healthcare professional should talk to them about what modern and scientific treatments and medicine can do to help them, on top of what they already believe in. Another major belief is that mental health issues are not real. Many Turkish people delay seeking help because there is a stigma around mental health issues. To respect this, healthcare professionals should try and inform the patient without offending their beliefs that what they are feeling happens to a lot of people and can be treated, and that they would feel a lot better. Lastly, emotions and feelings are often hidden. Because of this, many patients have a hard time trying to define how much pain they're in. Professionals can help this by focusing on more questions with objective systems and not subjective ones.
Now, let's move on to Muslims. During the month of Ramadan, Muslims fast from sunrise to sunset. This is a deep part of their religion, but it can also cause many health problems in some patients. If this problem occurs, the healthcare professional should explain to the patient why and how fasting is harming their health and well-being. However, because this is such a sacred practice, it wouldn't be surprising if the patient refuses to stop fasting. In this case, the professional should stop focusing on preventing the patient from fasting and should focus more on actually educating the patient. For example, the worker should inform them that they should eat meals with carbohydrates so that energy is released slower. Advice like this will make it so that the patient can keep on fasting while being safer in regards to their health. Furthermore, the privacy of Muslims is very important to them. One major rule is that a Muslim should only be examined by a doctor or nurse of the same gender. If this accommodation simply can't be made, a family member should be allowed to stay in the room while the patient is being examined, as it makes the patient feel more comfortable. Additionally, it's very common for a female Muslim to not shake the hand of a male healthcare professional. This should not be taken as a sign of disrespect or rejection. Instead, it's just a way to express their modesty. In conclusion, if healthcare professionals can work to accommodate and respect the cultures of others, the quality of healthcare would be a lot better, and this is a goal that all workers should try to achieve. These are my works cited. Thank you so much for watching.